Now, here is a person who is motionless and lying on the floor. What do you do first? First thing is ensure scene safety. That is, what is scene safety? Suppose this person is on the road. You have to move him away from the road because there will be so many vehicles moving. So please move him away from the road or form a human circle around him, or put some red flags, red triangles around 45 to 50 meters all around. Okay, here we have a person who is lying down motionless, has collapsed on the floor. What do I do first? I have ensured scene safety. Now I have to check whether the person is conscious or not. So please shake the person and shout loudly. If you know his name, please call out the name. Hello? Hello? Now, you have checked a person for consciousness. He is not conscious. Now, the next step is, first, if you are the only person, please activate the emergency system and get back to the person as soon as possible. But if there are two of you, please send one person to get help, medical help, and you proceed on to check for breathing. But if you are the only one, first activate the emergency system and then get to check for breathing. So how do I check for breathing? Tilt the forehead. Lift the chin with your two fingers, but please do not press on the soft part of the neck. If you see anything in the mouth which is easily removable, please remove. But never poke your finger blindly inside. You may do more harm than good. So now check for breathing. Look whether his chest is moving with each breath. Feel for the breath. And also listen to the breath. Look, feel and listen. Now, we have a person here lying down motionless. We have checked for consciousness, he is not conscious. We have checked for breathing, he is not breathing. Now we have to go ahead with CPR. Also remember, when I mean the person is not breathing, it may be that he is not breathing at all or he is gasping. What is CPR? Cardio-Pulmonary resuscitation. So we are going to get the heart to beat and the lungs to breathe. They have stopped working. Now we have to get them going. So how do I go about it? First, we will learn about chest compressions. Okay? So where do I give chest compressions? On the lower part of the breastbone, but without touching the tip of the breastbone. That is the position where we have to give chest compressions. How do I give them? So you put the heel of one hand and then put the other hand over it, and you give chest compressions at the rate of 100 per minute, but not more than 120 per minute. Make sure you press deep enough, around 2 inches deep but not more than 2.4 inches, and please allow the chest to recoil. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So make sure the pressure comes from above. Make sure your elbows are not bent. Okay? You have to give good pressure. Now, you have learnt about chest compressions. How do you give breaths? Tilt the forehead, pinch the nose, lift the chin to open the airway, and make sure you don't press on the soft part of the neck. Take a nice deep breath, Form a seal around the person's mouth with your own mouth. Tight seal so that air doesn't leak, and breathe in for 1 second. So, if you are not able to see the chest moving, please readjust the head tilt, chin lift, and if you are not able to form a seal around the mouth, you can even close the mouth and breathe through the nose. But please check whether you are able to give an effective breath. So, when you are giving the breath, please look at the person's chest. Okay, so you have learned how to give chest compressions, you have learned how to give breaths. How do I give them? Always start with chest compressions first. Give 30 chest compressions and 2 breaths. 30 chest compressions and 2 breaths. Till when? Till expert help arrives, or you have revived the person, or you are exhausted, in which case you have to hand over to someone else to do the chest thrusts and the breaths. Okay, now you have revived the person, you have put in the recovery position. Please keep monitoring and wait for help. Now, there are some exceptions. Suppose it is a victim of near drowning, or an accident victim, or a victim of intoxication. In such cases, if you are the only rescuer, first give at least 2 minutes of CPR before you leave the person to activate the emergency system. Suppose you don't want to give breaths, you have a handkerchief, you can protect yourself by using it, but in spite of that you don't want to give breaths, or you are not able to give effective breaths. In that case, you can just give chest compressions at the rate of 100 per minute. There is something called automated external defibrillator. This machine is available in malls, airports, railway stations, and big offices and big shops. So, what does it do? Many a times in older kids and adults, the cause of heart stopping to beat may be because of an abnormal rhythm. This machine helps us in getting heart to have a normal rhythm and beat normally. But please do not waste time waiting for the machine. Do your CPR, arrange for the machine, and once you connect the machine, it will give you instructions, prompts as to when to give shock and when to do CPR. We will discuss about this in one of our subsequent videos.
Please subscribe to this channel and give this video a big thumbs up.
We do want to make a difference.